so today we're going to do masseter Botox. So this lady here has got jaw pain and grinds her teeth as well. So she wants to, because they're eroding her teeth, and she also has pain down here and also gets headaches. So today we're going to treat her masseter muscle, which is the muscle here that helps with eating, and so it just softens it a little bit so the clenching won't be as strong, because obviously it's freezing the muscle there, but not totally. So just clench for me so I can see it's here, and we're just going to draw a line so we don't go too high, and we'll do 3 to 4 injection points there.